NCQA's Patient-Centered Medical Home program highlights primary care providers who have shown us they can coordinate care among all of a patient's doctors and other healthcare providers. You get better access through expanded hours. The result is better quality and fewer costly trips to emergency rooms and hospitals. You get help understanding treatment options and are a partner in decisions about your care. Patient education resources, weekly newsletter, preventative services in our diagnostic center and our lab, wellness days, case management program for comprehensive care. Patient education resources that we provide are the educational material that's on our website, and there's quite a bit of it. And we also have brochures and pamphlets around our office that provide patients with educational material. The weekly newsletter is a newsletter that we send through the email from our website to about 10,000 patients. The topics that we cover are very interesting topics and topics that are important to our patients, such as diabetes, preventative health measures, weight management, all the topics that people are interested in. We offer several preventative services in our diagnostic center and our lab. For example, we do carotid ultrasounds to screen for carotid artery disease. We can also check the circulation of our patients by measuring the blood pressure in their arms and comparing it to the blood pressure in their legs. If it's abnormal, they would go on for further testing, but it's a great screening test for peripheral arterial disease. And we can also do bone density studies called DEXA scans to screen for thin bones, osteoporosis. We can perform EKGs to check the heart rhythm, and for any abnormalities that could signal that there's a potential problem with the patient's heart. We can do echocardiograms, which is an ultrasound of the heart to look at the heart valves and the size of the heart and how well the heart is pumping. And we also have wellness days once a month in the office where we can screen patients at one time. The patient can have several screening tests done in one day. And an example of that would be screening for diabetic retinopathy, where retinopathy exams can be performed in the office. The actual images are reviewed by an ophthalmologist. We can do screening for neuropathy. It's common in diabetic patients to have peripheral neuropathy, and we have a screening test for that. And as I mentioned earlier, we can also screen for peripheral arterial disease by checking blood pressures in the arm and comparing them to the blood pressures in the legs. Our case management program for comprehensive care is primarily for our patients who have multiple medical problems and that require coordination of their care. We have case managers in the office that the patient would be assigned to help them coordinate their care. They might assist them with helping them with transportation to an appointment with another physician, or they may need coordination of receiving appointments here in our office, maybe more than 2 appointments in the same day due to problems with transportation. And they also may need assistance with understanding what their medications are for, how to take their medications, and we also can remind them about refilling their medications. And there's so much more, but that's the basic idea of case management. You have better access through expanded hours and the web. We're open 7 days a week to provide our patients better access to the practice so they can get their needs met. If a patient doesn't have access to their physician or their nurse practitioner or one of the specialists, that may mean that they'll take a trip to the emergency room or the hospital, which could have been prevented. We have providers who are always on call 24 hours a day, and these include our specialists, primary care physicians, and nurse practitioners. So after the office closes at the end of the day, our providers are on call for our patients 24 hours a day, 7 days a week. We have privileges at local hospitals and nursing homes, and it's our doctors in our practice who see you. And that's important because this maintains continuity of care. We know the patients, we know you, and you know us, you know the way we practice. Our patient portal is a really great benefit for our patients because it gives them access to information that they can see on the computer. They can see their lab results without having to call the office and ask for their lab results. They can also update their demographics, their allergies. They can view their medications. If they see any discrepancies in the data in their medical record, they can call us and we can correct it. Telemedicine is like having an office visit, like a video conference. It's a way to communicate with your provider without leaving your home. It's important for patients to have same-day appointments because some patients have acute problems that need to be dealt with that day. And if we delay dealing with their problem, it can become a bigger problem. Providers work in teams to prevent problems and manage chronic conditions to keep you healthy. Primary care team and ancillaries, pharmacist, dietitian, mental health counselor, case manager, chronic care management program, daily huddles before day begins. Primary care team meets to review who's in the hospital, who went to the ER, who's coming in that day, handling significant abnormal test results. Multi-specialty, specialists available in our facility.